Dear students, my name is Avinash, lecturer in the Department of Electronics and Communication Engineering, Jain Polytechnic, Belagavi. In this session, we will learn the concept of telemedicine. The contents covered in this session are Introduction to Telemedicine, Applications of Telemedicine, a simple telemedicine system, telemedicine using mobile communication, and telemedicine using satellite communication. So let's start with the introduction. As all we know, quality, equity, access and cost effectiveness are the key issues facing the healthcare in both developed and as well as less economically developed countries. The modern information and communication technologies such as computers, internet, the cell phones are revolutionizing how individuals communicate with each other, seek and exchange the information and enrich their lives. These technologies have a great potential to help address contemporary global health problems. Okay, the same technology also can be used in a telemedicine. So, using all these technologies, we can say that telemedicine refers to the practice of caring patients remotely when the provider and patients are not physically present with each other. We can also say that telemedicine is the tool that makes healthcare more accessible, cost effective, and that increases patient engagement. In this telemedicine system, physician and patients can share information in real time from one computer screen to another. And even they can see and capture readings from several medical devices at a faraway location. Using telemedicine softwares, patients can see a doctor for diagnosis and treatment without having to wait for an appointment. Patient can consult physician at their comfort of their home. And hence, telemedicine can be defined as the use of modern telecommunication and information technologies in order to provide clinical health care available at remote places. In simple form of telemedicine system, the medical information is transferred over the phone or over the internet. Today, most of the people have access to basic telemedicine devices like mobile phones and computers. With improved accessibility, individuals in rural areas and busy urban areas can connect with provider easily. Home use medical devices make it possible for caregivers to monitor everything from vitals to glucose levels. Physicians can gather the essential medical information and make a diagnosis without patients stepping foot in a doctor's office. Okay, this is the introduction of our telemedicine system. Now move to the next concept. As listed in the slide, as you can see in the slide, telemedicine has 4 applicable elements, and that first one is its purpose is to provide clinical support. The purpose of the telemedicine is to provide clinical support. It means that telemedicine is mainly intended to provide a clinical support to the needy persons who are at a remote location. Okay. The second element, it is intended to overcome geographical barriers and connecting users who are not in the same physical location. It means that, as already we discussed, telemedicine can be used to support medical service at remote location at any corner of the world, at a remotest corner of the world. A person may be sitting at any country, in any country, can get a clinical support from the medical expert who are may at a longer distance or maybe from other countries. Okay, this removes the geographical barriers between the practitioner and the patient. The third element, it involves the use of various types of modern tools. It means that the telemedicine use the modern equipments like the computers, mobile phones, etc. And the fourth element, the goal of the telemedicine is to improve the health outcomes. As per the World Health Organization, ultimate goal of the telemedicine is to improve the quality of clinical services and hence improve the health outcomes. Okay, these are the elements, you can say the applicable elements of telemedicine. Now moving to the next concept. Next concept is applications of telemedicine. There are number of applications of telemedicine. As you can see in the slide, I have listed some of the different practical applications of telemedicine. So let's study all these applications one by one. So in that first one is chronic disease management. Okay, with the high-tech medical devices, physicians can now monitor their patients' health over long distances. Touchscreen technology allows providers to access heart rate, blood pressure, glucose levels, and more through the transmission of data from one device to the another device. Today, when readings fall out of the range, okay, then the physician can intervene in the real time and which leads to better health outcomes. Okay, this is the first application. Second one is medication management. Those in the healthcare industry recognize that medication management is a big deal, especially among seniors. Older adults are more likely to forget to take their medications, which is where telemedicine comes in. Providers and other healthcare professionals can use telemedicine technology to monitor when and if their patients took their medicines. As a result, this leads to fewer hospital readmissions and enhances medication compliances. Okay. The third application, sharing medical information. Store and forward. In this, sharing medical information, store and forward comes into picture. Store and forward is a type of telemedicine that allows providers to share information over a distance and hence it has been a game changer. Today, primary care physicians can connect with specialists who are in another location than them. Healthcare information like diagnostic images, blood analysis, and more can be shared for appropriate patient's assessment in real time. Okay. The next application is disaster relief. When a disaster occurs, the local healthcare resources are immediately pulled in to provide both emergent and non-emergent care. This is usually result in shortage as the demand for service is much higher than what can be supplied. With telemedicine, physicians in the other locations can provide assistance by conducting video visits. Okay. The next application is paramedic or ambulatory. It is not uncommon for an emergency department to shut down after reaching capacity. This leads to ambulances taking patients to the hospital that are further away, and this ultimately affects their outcome. By using telemedicine, paramedics can use technology to seize the capacity of an emergency room in real time instead of heading to the hospital and then being diverted later. Also, when emergency rooms, or you can say the ICU rooms, begin using video consultations to triage their patients, it gets the non-emergent cases out sooner. This leads to less ambulance diversion and better patient outcomes. Now, the next application is telemedicine for remote clinics. In this context, doctor is not physically present inside the store or hospital. Instead, the customer or a patient uses a touchscreen computer to type in their system. Means the patient simply type his or her symptoms in a chatbot and then enters into the virtual waiting room. They are then connected by a video link to the doctor. When simply that doctor reads those chats or comments, he give a video link so that both patient and doctors are connected. This this also reduces the appointment and all those concepts. Okay, now moving to the next application, that is mobile health. Sometime the answer to the question that what is telemedicine, it is simply use of mobile medicine, that's it. Okay, it doesn't require a heavy desktop computers or a lot of equipments. Activities that is used to happen only in a person are now easy to do on a smartphone. Modern consumers are customized to downloading apps and using their smartphone for simple transaction. The same is true for doctor visits. Now move to the next concept, that is a simple telemedicine system. In the slide we have a simple block diagram for a telemedicine system. This telemedicine system is divided into two parts. One is the transmitter, which is at the remote location, and another a receiver section, which is at the medical practitioner or towards an observer. Okay, the transmitter session has different blocks like biosignal acquisition, signal conditioner, text edit, scanner, computer. Okay, this computer is used to collect all the data from the patient. For example, this biosignal acquisition, it is a block in which the different physiological parameters like the temperature of the human body, blood pressure, etc. are collected with the help of sensor, and then those collected signals are given to the signal conditioner. In the signal conditioner, all the data whatever collected are converted into digital form and then given to the computer, that is PC. Okay, now if the patient feeling some difficulties or symptoms, he or she can enter, means simply type his or her symptoms in the text edit. It's like a chat bot. Okay, their patients are simply entering their symptoms, and then those symptoms are entering in the PC, and then all the data collected is transferred using transmitter. This is the transmission section, and once these are transmitted, all those data can be received at the receiver center, at the receiver side by the medical practitioner. In the receiver side, first a signal conditioner is there. Again, whatever the analog signal is there, that is again converted into the digital signal with the help of signal conditioner, and if necessary some amplification also done on those signals. Okay, and now those digital signals are given to the personal computers, where a physician or a doctor can see all the physiological parameters sent by the patient at the transmitter session. For example, whatever the symptoms the patient has typed in the text edit, or the whatever the signals like temperature the symptoms collected by the sensors like temperature or blood pressures, all are observed by the physician. So this shows a simple telemedicine system. Okay, this shows a simple telemedicine system. Now moving to the next concept, that is telemedicine using mobile communication. Okay, so before going to telemedicine using mobile communication, we should know what is mobile communication. So the mobile communication is the use of technology that allow us to communicate with others in different locations without the use of any physical connection. Okay, so this technology, this mobile communication technology, is also used to connect the patient and doctor who are separated far away, who are at a long distance. Okay, with the help of this mobile communication. So as you can see in the slide, there are two sections. One is the mobile station, another one is a fixed station. Mobile station, it is a patient premise, whereas the fixed station is the medical practitioner's premise. Okay, in the mobile station, or you can say the patient's premise, the different physical parameters, physiological parameters like ECG or the patient's audio, blood pressures, all are collected, and even the video of the patient are taken, and all those are multiplexed. Okay, means all these are multiplexed and they are transferred over the mobile communication towards the doctor. Okay, means the physical signals like ECG signals, EEG signals, EMG signals. Okay, the sound of the signal, audio of the patient, the video of the patient, and then the body temperature, etc. are collected, and all those signals are multiplexed, and then those are transferred with the help of transmitter as shown in the figure. Now, at the receiver side, means at the fixed station, the doctor have a PC, and again he can simply he has the video display, means he or she is going to observe the video, means video of that patient, and similarly he is going to see the different connections like ECG signals, EEG signals, etc., and also the audio that is transmitted by the patient. Okay, this gives the complete picture of telemedicine using the mobile communication. Now moving to the next concept, that is telemedicine using the satellite communication. Okay, this concept is also very similar to the previous concept what we have studied, that is telemedicine using mobile communication. Here the everything remains same, but the only transmission media is the satellite. Okay, so before going to this concept, we should know what is satellite communication. Okay, in a telecommunications, the use of artificial satellites to provide the communication links between the various points on the earth is known as satellite communication. Okay, so here in this slide you can see there are two sections. One is the mobile station, another one is fixed station. Again the same, the mobile station is the patient premise, whereas the fixed station is the doctor's premise. Okay, in the mobile station, the different physiological parameters of the patient like audio, ECG of the patient, blood pressure of the patient, body temperature of the patients are collected, and even the video of the patients are collected, and all they are coded, means all they are coded, and all these signals are multiplexed, and then with the help of transmitter antenna they are transmitted towards the destination using satellites. Okay, and once the multiplexed signals received by the doctor at fixed stations, they are using demultiplexer to separate all the signals like audio signals, ECG signals, blood pressure signals, video of the patients. Okay, and with the help of decoder, all these signals are read using different readout devices by the doctor. Okay, and now based on the observation, doctor will provide some observations and some tips to the patient that he or she can take. Okay, whatever simply doctor gives the audio directions or video directions. Okay, those audio and video are transmitted to the mobile station again with the help of satellite, and now the satellite will simply carry the data sent by the doctor and send it to the patient premises. Okay, and this achieves a telemedicine using the satellite communication. Okay, this can cover a very large geographical areas. Okay, now moving to the last concept of this session, that is home care telemedicine. Okay, in this home care telemedicine, the patient is kept at the home only. Okay, and to that patient different sensors are attached like body temperature sensor, blood pressure sensor, ECG sensors, and again different types of sensors are attached. Okay, all the data collected by these different types of sensors are multiplexed, and they are transferred to the hospital monitoring center over the PSTN. As you can see in the slide, the patient is kept in the home only, and to that patient sensors are given attached, and whatever the data collected by those sensors are multiplexed, and then they are transferred with the help of public switched telephone networks. Okay, we are using the telephone lines to transfer the data. Okay, now once all the data received